Boxer dogs and neutering/spaying, pros, cons, and FAQs. Boxer dogs are beloved companions known for their playful and energetic nature. When it comes to their reproductive health, the topic of neutering or spaying often arises. In this video, we will delve into the pros, cons, and frequently asked questions surrounding the neutering and spaying of boxer dogs. Neutering or spaying your boxer dog can have several benefits. Firstly, it can help prevent certain health issues such as testicular cancer and uterine infections. By removing the reproductive organs, the risk of these diseases is significantly reduced, promoting a healthier and longer life for your furry friend. Additionally, neutering or spaying can have positive behavioral effects. It can help reduce aggression, roaming tendencies, and the urge to mark territory. This can make your boxer dog more manageable and less likely to engage in undesirable behaviors. However, it's important to consider the potential drawbacks as well. Neutering or spaying can lead to changes in your boxer dog's behavior and temperament. Some dogs may become more docile and less energetic, while others may experience weight gain. It's crucial to monitor your dog's behavior and consult with a veterinarian if you notice any significant changes. Furthermore, there may be possible medical complications associated with the procedure. While rare, surgical complications, such as infection or adverse reactions to anesthesia, can occur. It's essential to discuss these risks with your veterinarian and ensure that your boxer dog receives proper postoperative care. Now, let's address some frequently asked questions about neutering or spaying boxer dogs. At what age should I consider neutering or spaying my boxer dog? What are the potential long-term health effects of the procedure? Will my dog's behavior change after being neutered or spayed? Are there any alternatives to surgical neutering or spaying? By exploring these questions and more, we aim to provide you with a comprehensive understanding of the benefits, drawbacks, and frequently asked questions surrounding the neutering and spaying of boxer dogs. Health benefits of neutering/spaying boxer dogs. Neutering or spaying boxer dogs can have numerous health benefits that contribute to their overall well-being. By undergoing this procedure, boxer dogs can experience a significant improvement in their health and quality of life. One of the main health benefits of neutering or spaying boxer dogs is the prevention of certain reproductive organ-related diseases. For female boxers, spaying eliminates the risk of developing uterine infections, ovarian cysts, and even certain types of cancer, such as mammary gland tumors. Neutering male boxers, on the other hand, reduces the risk of testicular cancer and prostate problems. Furthermore, neutering or spaying boxer dogs can also help in minimizing the risk of certain behavioral issues. Unneutered male boxers are more prone to roaming, aggression, and marking territory with urine. By neutering them, these behaviors can often be reduced or eliminated, making them more manageable and easier to train. Spaying female boxers can also prevent the occurrence of heat cycles, which can be stressful for both the dog and the owner. In addition to these benefits, neutering or spaying boxer dogs can contribute to the overall pet population control. By preventing unwanted pregnancies, it helps in reducing the number of stray and abandoned dogs, ultimately alleviating the burden on animal shelters and rescue organizations. It is important to note that the decision to neuter or spay a boxer dog should be made in consultation with a veterinarian. They can provide personalized advice based on the specific needs and circumstances of the dog. While there are numerous health benefits associated with the procedure, it is essential to weigh them against any potential drawbacks or risks. Potential drawbacks of neutering/spaying boxer dogs. Neutering or spaying boxer dogs can offer numerous health benefits and help control the pet population, but it is important to consider the potential drawbacks or risks associated with these procedures. While the advantages of neutering or spaying are widely recognized, it is essential to make an informed decision based on your individual dog's needs and circumstances. One potential drawback of neutering or spaying boxer dogs is the possibility of behavioral changes. Some owners have reported that their dogs become less energetic or more prone to weight gain after the procedure. However, it is important to note that these changes are not universal and can vary from dog to dog. Additionally, behavioral changes can often be managed through proper exercise, diet, and training. Another potential drawback is the risk of medical complications that may arise from the surgery. Like any surgical procedure, there is a small chance of infection, bleeding, or adverse reactions to anesthesia. However, these risks are generally low, especially when the procedure is performed by a qualified veterinarian in a controlled environment. Furthermore, there are concerns about the long-term health effects of neutering or spaying boxer dogs. Some studies suggest that neutering or spaying may increase the risk of certain health conditions, such as certain types of cancer or orthopedic issues. However, the evidence is not conclusive, and the overall health benefits of these procedures often outweigh the potential risks. It is important to consult with a veterinarian to weigh the potential drawbacks and risks against the benefits of neutering or spaying your boxer dog. They can provide personalized advice based on your dog's age, health, and individual circumstances. Ultimately, the decision should be made in the best interest of your pet's overall well-being. Behavioral changes after neutering/spaying. When it comes to neutering or spaying boxer dogs, it's important to consider the potential behavioral changes that may occur as a result of the procedure. While every dog is unique and may react differently, there are some common patterns that can help us understand what to expect. One of the most noticeable behavioral changes after neutering or spaying is a decrease in aggressive and dominant behaviors. This is particularly true for male boxer dogs, as the procedure reduces their testosterone levels. Without the influence of this hormone, male boxers tend to become less territorial and less likely to engage in aggressive behaviors towards other dogs or humans. Additionally, neutering or spaying can also have a calming effect on boxer dogs. They may become less hyperactive and more relaxed, making them easier to train and handle. This can be especially beneficial for families with young children or for individuals who are looking for a more laid-back companion. However, it's important to note that not all behavioral changes are positive. Some boxer dogs may experience an increase in separation anxiety after being neutered or spayed. This could manifest as excessive barking, destructive behaviors, or even attempts to escape. It's crucial for dog owners to provide their pets with proper mental and physical stimulation to help alleviate these anxieties. In some cases, neutering or spaying may also impact the social behavior of boxer dogs. They may become less interested in interacting with other dogs or may display less dominant behavior during play. While this can be seen as a positive change for some owners, it's essential to monitor their social interactions and provide appropriate socialization opportunities to ensure their well-being. Overall, the behavioral changes that occur after neutering or spaying boxer dogs can vary from dog to dog. It's important for owners to be aware of these potential changes and to provide their pets with the necessary support and training to help them adjust to their new hormonal balance. By understanding and addressing these behavioral changes, we can ensure the well-being and happiness of our beloved boxer companions. Possible medical complications. Possible medical complications. When it comes to neutering or spaying boxer dogs, there are potential medical complications that pet owners should be aware of. While these complications are not common, it is important to understand the risks involved in the procedure. One potential complication is the risk of infection. Any surgical procedure carries the risk of infection, and neutering or spaying is no exception. Infections can occur at the incision site and may require additional medical treatment. Another possible complication is the development of a seroma. A seroma is a pocket of fluid that can form near the incision site. While seromas are usually harmless and resolve on their own, they can sometimes become infected or cause discomfort for the dog. Additionally, there is a small risk of excessive bleeding during or after the surgery. Boxer dogs, like other breeds, can have variations in their blood clotting abilities, which can increase the risk of bleeding complications. It is also important to note that neutering or spaying can have an impact on a dog's hormone levels. While this is typically a desired effect, as it helps to prevent certain health issues, it can also lead to hormonal imbalances in some cases. These imbalances can potentially result in changes in behavior or other health concerns. Overall, while the majority of boxer dogs undergo the neutering or spaying procedure without any complications, it is crucial for pet owners to be aware of the potential risks involved. Consulting with a veterinarian and discussing any concerns or questions can help ensure the best possible outcome for your beloved boxer. Impact on long-term health. When it comes to the long-term health of boxer dogs, the decision to neuter or spay can have both positive and negative effects. Let's delve into the potential impact of these procedures on the overall well-being of these beloved pets. On the positive side, neutering or spaying boxer dogs can significantly reduce the risk of certain health issues. For female boxers, spaying eliminates the possibility of uterine infections and reduces the risk of mammary tumors, especially if done before their first heat cycle. Neutering male boxers can prevent testicular cancer and reduce the likelihood of prostate problems. However, it's important to consider that there are potential drawbacks to neutering or spaying boxer dogs. One of the main concerns is the potential for weight gain. After the procedure, boxers may experience a decrease in metabolism, which can lead to weight gain if their diet and exercise routine are not properly managed. Obesity can contribute to various health problems, including joint issues and heart disease. Another aspect to consider is the impact on the development of certain diseases. Studies have shown that neutering or spaying boxer dogs at an early age can increase the risk of certain orthopedic conditions, such as hip dysplasia and cruciate ligament tears. These conditions can cause pain and mobility issues in the long run. It's important to weigh the potential benefits and risks when making a decision about the long-term health of boxer dogs. Consulting with a veterinarian can provide valuable insights and guidance based on the individual needs and circumstances of your furry companion. Frequently asked questions about neutering/spaying boxer dogs. Neutering or spaying boxer dogs is a common practice that raises several questions for pet owners. Here are some frequently asked questions about the procedure. Question: what is the ideal age to neuter or spay a boxer dog? A. The ideal age for neutering or spaying a boxer dog is typically between 6 and 9 months. However, it is best to consult with your veterinarian to determine the optimal time based on your dog's individual needs and development. Question: will neutering or spaying my boxer dog change their behavior? A. Neutering or spaying can have an impact on a boxer dog's behavior. It may help reduce aggressive tendencies, roaming behavior, and certain undesirable habits. However, it is important to note that individual responses may vary. Question: can neutering or spaying prevent certain health issues in boxer dogs? A. Yes, neutering or spaying boxer dogs can help prevent certain health issues such as uterine infections, testicular cancer, and certain types of tumors. It is recommended to discuss the potential benefits with your veterinarian. Question: will my boxer dog gain weight after being neutered or spayed? A. Neutering or spaying may cause a slight decrease in metabolism, which can lead to weight gain if dietary adjustments are not made. It is important to monitor your dog's diet and engage in regular exercise to maintain a healthy weight. Question: can I still breed my boxer dog if they are neutered or spayed? A. No, neutering or spaying removes the reproductive organs, making breeding impossible. If you wish to breed your boxer dog, it is essential to refrain from the procedure. Remember, it is crucial to consult with your veterinarian before making any decisions regarding the neutering or spaying of your boxer dog. They can provide personalized advice based on your dog's specific needs and circumstances. When to neuter/spay boxer dogs, age and timing. When it comes to neutering or spaying boxer dogs, determining the appropriate age and timing is crucial. While there is no one-size-fits-all answer, there are some guidelines that can help you make an informed decision. Generally, it is recommended to wait until boxer dogs reach sexual maturity before considering neutering or spaying. This typically occurs between 6 to 9 months of age. Waiting until this stage allows the dog's body to fully develop and reduces the risk of potential complications. However, it's important to consult with your veterinarian to determine the best age for your specific boxer dog. Factors such as the dog's overall health, breed, and individual circumstances can influence the ideal timing for the procedure. Early neutering or spaying, which is typically done before the age of 6 months, may have some benefits, such as a reduced risk of certain reproductive-related health issues. However, it's essential to consider the potential risks associated with early procedures, such as an increased risk of certain orthopedic problems. On the other hand, delaying the procedure beyond the recommended age range may also have its considerations. Boxer dogs that are not neutered or spayed may be at a higher risk of certain reproductive-related health issues, such as mammary tumors or testicular cancer. In addition to age, other factors to consider when determining the appropriate timing for neutering or spaying include the dog's lifestyle, behavior, and your own personal circumstances. Discussing these factors with your veterinarian will help you make an informed decision that is best for your boxer dog's overall well-being. Benefits and risks of early neutering/spaying. When it comes to the neutering or spaying of boxer dogs, there are both benefits and risks to consider, particularly when it comes to doing so at an early age. Let's take a closer look at the advantages and potential drawbacks of early neutering or spaying. Benefits of early neutering/spaying. Population control. One of the primary benefits of early neutering or spaying is the prevention of unwanted litters. By sterilizing boxer dogs at a young age, it helps to control the population of stray dogs and reduces the number of animals that end up in shelters. Health benefits. Early neutering or spaying can also have health benefits for boxer dogs. It can help prevent certain types of cancers, such as testicular and mammary cancers. Additionally, it can reduce the risk of certain reproductive system diseases, such as pyometra in females. Behavioral benefits. Neutering or spaying at an early age can also help in managing certain behavioral issues. It can reduce aggressive behaviors, such as territorial marking and roaming in males, and minimize the likelihood of females going into heat, which can lead to unwanted attention from male dogs. Risks of early neutering/spaying. Surgical risks. Like any surgical procedure, there are inherent risks involved with early neutering or spaying. These risks include anesthesia complications, infection, and postoperative pain. It is important to discuss these risks with a veterinarian and ensure that the procedure is performed by a qualified professional. Growth and development. Early neutering or spaying may have an impact on the growth and development of boxer dogs. Some studies suggest that it can lead to certain orthopedic issues, such as an increased risk of hip dysplasia and certain bone cancers. However, more research is needed to fully understand the long-term effects. Hormonal changes. Neutering or spaying at an early age can result in hormonal changes that may affect the behavior and physical appearance of boxer dogs. For example, neutered males may have a reduced muscle mass and a higher risk of obesity. Ultimately, the decision to neuter or spay a boxer dog at an early age should be made in consultation with a veterinarian. They can provide guidance based on the individual dog's health, breed characteristics, and lifestyle. It's important to weigh the potential benefits against the risks and make an informed decision that prioritizes the well-being of your furry friend. Considerations for delayed neutering/spaying. When it comes to the decision of whether to delay the neutering or spaying of boxer dogs, there are several important factors to consider. While the traditional approach has been to perform the procedure at a young age, there is a growing trend towards delayed neutering or spaying. Here are some considerations to keep in mind. Physical development. Delaying the procedure allows boxer dogs to fully develop physically before undergoing surgery. This can be beneficial for their bone and muscle growth, as well as their overall physical maturity. Hormonal balance. Neutering or spaying at a later stage allows boxer dogs to experience the natural hormonal changes that occur during puberty. Some experts believe that this can have a positive impact on their behavior and temperament. Health risks. It is important to weigh the potential health risks associated with delaying the procedure. Boxer dogs that are not neutered or spayed are at a higher risk of certain health conditions, such as reproductive organ cancers and infections. Reproductive considerations. If you are considering breeding your boxer dog in the future, delaying the procedure is necessary. However, it is important to consult with a veterinarian to ensure that you have a proper plan in place for responsible breeding. Ultimately, The decision to delay the neutering or spaying of boxer dogs should be made in consultation with a veterinarian. They can provide guidance based on the individual needs and circumstances of your pet. It is important to weigh the potential benefits and risks and make an informed decision that prioritizes the overall well-being of your beloved boxer companion.